Hello everyone, this is Faisal Rashid and today I am here to discuss about anti-tussive drugs. What are anti-tussive drugs? So before going to discuss our today's topic, I will give an overview to you people that what we will discuss in today's topic. That is, first we will discuss about cough, that what is cough, then mechanism of coughing and types of cough, drugs against coughing, antitussive simply, which is our main topic of today, and that will be the end of our topic. So I will discuss about first cough, that what is cough. Cough is a protective reflex, as the name indicates, that it is a protective action which is used to clear our throat or respiratory tract from the mucus secretion that is present in it. While there are some conditions which will induce coughing, so these are two in number. Actually, there are many conditions which will induce coughing, but simply here we will discuss about two conditions that is very clear to us, that the nasal secretion that are drawn back to the respiratory tract will induce coughing, because the respiratory tract will be blocked by this secretion. So in order to clear that secretion, we must have coughing action so that these nasal secretion is removed. Now going toward the mucus secretion accumulated inside the passage, that is same as the above, but it is secreted by the mucous membranes present in the respiratory tract, which will induce coughing. So simply these two conditions are inducing cough. So going toward our next slide, that what we will discuss about the mechanism of action. So now discussing about the mechanism of action of coughing, so it is simple. I will just draw an overview about that. I will not go in further detail because we have to go on or for the main topic. So stimulus for cough, that is represented by star, you may say, will enter into the respiratory tract. Now the respiratory tract, such as throat or lung stretch receptor, chemoreceptor or mechanoreceptor present in the respiratory tract, will send message to the cough center that is present in the medulla oblongata. Then what happened really? The cough center medulla oblongata process that information that is sent by mechanoreceptor to vagus nerve to the cough center will be processed, and then the message is sent to the contractive muscle, that are diaphragmatic muscle, abdominal muscle and intercostal muscle, that will cause contraction. The message is sent to by the motor nerve to these muscle. Now when the contraction occur in abdominal or intercostal muscle, a noisy respiration is expelled out, which is usually called as cough. So again the stimulus is repeated, which will repeat the cycle again. This was the general mechanism of coughing. So now we will go toward the types of coughing. So the types of cough, there are two types of cough. One is productive cough and another is unproductive cough. In productive cough, the sputum is produced, i.e. the mucus secretion from the respiratory tract is accumulated. So in the form of sputum, they are produced inside the respiratory tract. So we call this type of cough as productive cough, while we use expectorant to remove these kind of secretion from the respiratory tract. Now, unproductive cough. Unproductive cough is not concerned with the mucus production because it is also called as dry cough, and no mucus secretion are produced inside the respiratory tract. So for that we will use antitussive drugs, which is our main topic. So we are going toward the antitussive drugs. What actually antitussive drugs are? These are of two types, narcotic and non-narcotic. While narcotic is also called as opioids, and non-narcotics are also called as non-opioids. So opioids include codeine, phalcodone, while non-opioid it includes dextromethorphan. So we will discuss about these three drugs one by one. So going toward these drugs. Now discussing about codeine. Codeine is a methylated morphine. Methylated morphine means it is a more type of morphine that is methylated, which is also known as 3-methyl morphine. These are basically alkaloids which are obtained from opium poppy, that is a plant, botanical plant. So it is obtained from opium poppy. So as they are methylated morphine, so they must be weak analgesic as compared to morphine, because morphine is original form and methylated morphine is a secondary form of morphine. So we can say that because of that secondary form, it is weak analgesic as compared to morphine. They are also used for mild to moderate pain. They are used for mild to moderate pain, as this is the same as the third number point, that weak analgesic. So used as for mild to moderate pain, mean for severe pain you must have a very potent drug like morphine to relieve pain. They are used widespread clinically for 50 years, more than 50 years old patient, as analgesic and antitussive drug. So it shows that it was a most used drug as opiate in the past. Going toward the clinical uses, so they are used for dry cough with combination of acetaminophen, and they are used to relieve pain. Same was in the introduction, that are analgesic. This discussing about the duration of action of codeine. So codeine suppresses the cough center for 6 hours approximately. We will discuss about the metabolism of this. So metabolism is concerned as that it is a prodrug. Prodrug means that it is inactive outside the body, so it must be metabolized by liver in the presence of enzyme called as CYP2D6. So it must be metabolized, otherwise it would not show any action inside the body. So it must be metabolized by liver. Now we will go toward the mechanism of action of codeine. So mechanism of action of codeine, and codeine simply anti-cough. So the cough center has mu receptor called as opioid receptor. These opioid receptors are specific for opioids. So as codeine is opioid, it will bind with opioids present in the cough center, will then, as it is bound with the opioid receptor, so it will be blocked, mean that the cough center is blocked for the cough receptor to initiate coughing. So that is the general sketch again, which was discussed earlier. So cough receptor will send to the message to the cough center, then it will stimulate the respiratory muscle, which will produce cough, and the cycle will be repeated. Now when we when we take codeine inside to our body, then the cuff center is blocked, that is shown by cross. So the cuff center will be blocked, and then after no stimulus will be processed to the respiratory muscle and no cuff will be reduced. This was a general mechanism of codeine. Now going toward the contraindication of the codeine, which must be keep in mind, otherwise it can lead to the death. It must not be used in productive cough. We should not use this drug like codeine because in productive cough, because the sputum will block the air passageway if not expelled out. If we think, then when the cough center is blocked in productive cough, so the productive cough, the sputum will remain still in the respiratory tract if these are not removed by the coughing action from the body. So if the cough center is blocked, these will not be removed and we will be having a great problem in breathing. So we cannot breathe. So unfortunately we will die because the air passageway is blocked. Going toward next, so it is contraindicated in asthmatic patient. It will cause breathing problem in asthmatic patient if we take codeine. What are the side effects? Side effects include respiratory depression, sedation, constipation. These are general side effects of the codeine. Going toward the adverse effect. Adverse effect, there are really great adverse effect of codeine which was ignored since it was formed. So it has a life-threatening effect on respiratory depression and may cause death, which have been reported in children who received codeine, most following tonsillectomy and adenodectomy, mean that these two kind of diseases were followed by most of the children who took codeine as a antitussive and analgesic. Another information, in 1969 to May 2012, 13 deaths were reported, which include pediatric death, which were 10 in number, and respiratory depression diseases were 3 in number, which lead them to death. 13 deaths reported only in published paper. Moreover, maybe many deaths will be done by this codeine effect. Going toward the next slide. So one interesting information about the codeine is that among most dispensed opioid, one study shows in 2011 that codeine was prescribed to more than 8 lakh patients who were younger than 11 years, which was more than any other opioids. So most used opioid was codeine. Going toward the next drug, that is falcodeine. Falcodeine is similar to codeine, but it has a very small difference from codeine. These are opioid suppressing cough center. Just as codeine, they are little or no analgesic. That is the difference between the falcodeine and codeine. They are also known as homocodeine or morpholinine ethyl morphine. These are the another name of falcodeine. Its duration of action is 12 hours, so mean that it is a bit more having duration of action. These are contraindicated in asthma and hypersensitivity. We will go toward our next slide. Dextromethorphan, DM, generally called as DM. These are highly effective and widely used non-opioid and antitussives. They are highly effective than codeine and falcodeine and widely used non-opioid as antitussive. So they are N-methyl D-aspartate antagonist, mean that they reverse the action of NMDA receptor. What are the clinical uses? NMDA antagonist will be discussed in the next slide, so don't afraid. Oops, coming towards the clinical uses. So these are analgesic. These are used as analgesic, are used as dry cough, used as cough suppressant, relieves pain. Regarding the structure of dextromethorphan, there are two isomers of dextromethorphan structure, that is D isomer and L isomer. D isomer has antitussive action while the L isomer has analgesic action. Now the side effect of dextromethorphan DM are dizziness, nausea, drowsiness and hallucination. Hallucination you may know better. Going toward our last slide. Mechanism of action of dextromethorphan. This is the general structure which represent the mechanism of action. So as NMDA receptor are present in the postsynaptic membrane, synaptic membrane, so we will take a part of the synaptic membrane and we will discuss the mechanism of action of first NMDA receptor, then we will discuss about the NMDA antagonist mechanism of action. So we will know about the dextromethorphan mechanism of action. These are the glutamate particles which are enclosed in vesicle present in the presynaptic membrane, and here it is a space between the presynaptic membrane and the postsynaptic membrane. Postsynaptic membrane has NMDA receptor. These are the two receptors which are called as NMDA receptor and methyl D aspartate receptors. So the calcium ion present between the space is get into the postsynaptic membrane when the glutamate particle bind to the NMDA receptor, so it will cause the opening of the channel, so calcium ion will get in, and in case the cyclic AMP will be increased, so the response will be reduced. Now what happened in the another NMDA antagonist, another action? So NMDA antagonist work as when these glutamate particles are released from the presynaptic membrane, the calcium ion are still present, but what is the difference? That is the dextromethorphan particles present we took inside the body, these will come and bind to the NMDA receptor, so will block the action of glutamate. Since the calcium plus ions will not get into the postsynaptic membrane, as a result there will be reduction in cyclic AMP, so the response for coughing is reduced and we feel a bit relief from coughing. And these are contraindicated in asthma. This was my video. Thanks for watching. Hope so we will meet in our next video. Thank you.